Yeah, it's fine. Um, yeah, so the reason I brought you on was to talk about vaccines, and also like this really weird thing that's going on in Florida.
Which one?
So, yeah. Um, I just want to talk about Florida fudging its numbers. Um,
Okay.
and about the evidence. The woman that made the coronavirus dashboard for Florida was talking about how she was um asked to cook the books uh so that the reopening plan could take place. But then she was fired. And I just wanted to share with you some of these numbers because I know that you are in the community more. Uh so basically if you're watching stream, I hope you are, cuz I don't want to risk two 1080p uploads at once.
Here, let me watch it. Sorry, if you hear me eating, it's because I am eating. I'm sorry.
It's all good. I understand. I eat on stream too. So I got this tool um that's talking about the ratio of COVID-19 hospitalizations to total bed, gives you the picture of how much strain a hospital is under. Though it is not a clear threshold, it's concerning when the rate rises above 10%, hospital capacity experts told NPR. Anything above 20% represents extreme stress for a hospital, according to the framework developed by the Institute for Health Metrics and Evaluation at the University of Washington. If the figure gets near 50% or above, the stress on staff is immense. It means the hospital is overloaded. It means other
Go on, sorry.
services that hospitals are being delayed. The hospital becomes a nightmare. Is this true?
So I think there is a lot of generalizations being made here, not by you, obviously. Um, what's actually the case is, and this is more of a recent phenomenon, um, the rate of hospitalizations is going down, and that's indicative of the extreme stress the hospitals are under because we don't have enough room to hospitalize more patients.
Yeah.
So, in fact, the better figure to go by would be which regions is hospitalization going down this month and next month.
Okay. Yeah. And then let me bring up what's going on in Florida.
Like what that was being said in terms of it going up and it being an indication of stress would be more applicable to like April or May,
I think it was talking about
but not now.
like just the current rate at which like hospitals are filled, you know?
No, for sure. Um, I'm just saying this rate is actually going down, being more indicative of overload of hospitals rather than it
Yeah.
going up. Yep.
So Florida obviously has a with what I told you, there is, there is evidence of Florida messing with the numbers. Um, and I just want to read see if these numbers make sense to you.
So it's not just Florida. Unfortunately, it's the case of all around the country.
Really?
Mm-hmm. Yep, that's something I talk about on stream a lot.
Is the
So
the misreporting?
yeah, it's not being misreported down. I mean, it's not being misreported up. It's being misreported down.
Yeah, yeah, I know. And that's what I was talking
Um,
about. I was,
so the woman in Florida is not the first one. It's just the only one. It's the only one that's made the news so far.
yeah, because this doesn't make sense. It doesn't make sense to have 11% of your adult inpatient being COVID-19, but you have 75% of the beds filled. And neither does 16 to 96%. You know?
Yeah, I mean, well, yeah, I mean, we can't look up these numbers to be honest. That's the problem.
Well, these are like 30% and 94%, 6 and 69. that doesn't make sense to me. You know?
Mm-hmm.
I do believe that the number is higher. Thanks for
Yeah,
coming by.
the number is higher. Unfortunately, we can't even rely on the results we're looking at right now.
Yeah, I'm just
So
showing it to show
yeah.
that it's
Mm-hmm.
that these numbers aren't reliable.
Mm-hmm. Yeah.
Like, that's crazy to me. So you're agreeing with me that these numbers are underrepresented? The number of patients are underrepresented?
Oh yeah. I mean, yeah. This is something I talk about a lot. They've been underrepresented since March or April. I mean, I'm not in Florida, and where I am, we were approached by our own state representatives to make the numbers comply with opening up. So
Wait, what?
yeah,
Really?
this is unfortunately the case all around the country. We're just now seeing it in Florida because this is the only, because she decided to publicly speak out against it.
Oh my god.
But yeah, this has been happening since March and April, definitely.
Wow.
You know, and she sort of sacrificed her own career to speak out publicly, and it's a tremendous sacrifice, and I'm at least glad that things like that are coming into light. You
Yeah,
know,
and you're
besides me
definitely
just saying it.
anonymous. Like,
Yeah,
I don't even
I
see
have
your
to be.
face.
Hmm. Hmm. I have to be because Xavier, I've been talking about this ever since I started streaming.
Yeah, that's crazy. Like,
You
I
know,
thought it was just Florida, or
nope, nope.
do you talk to like doctors other places as well?
Yeah, so one thing beautiful about the medical community is thousands of doctors all over the world. We all talk together in on Facebook. We have like Skype groups. We have email threads, all of that. We're all in constant contact with each other because we know for a fact, right? None of us represent the actions of our government. The people don't represent always the actions of the government. So, for the sake of good science, right, and scientific integrity, we're all in constant communication.
Uh-huh.
Um, you know, Chinese doctors that I completely trust informed us of the virus in December, way before our own federal government even mentioned it.
Yeah, yeah. I remember. Um, I remember like learning about it just a little bit last year. I like to stay informed.
Oh, for sure. Yeah.
Especially now that I run a stream that talks about politics every day. Um, but yeah, that's that's really crazy.
Mhm.
So what
Yeah.
exactly did they say when a state representative came to you?
So they didn't come to me specifically, but I'm part of the COVID research task force, and I know I work with statisticians, and they approached our statisticians of our institution. Um, and it was very clear. They were just like, "Hey, we would like you to, you know, make
Make
the
number
numbers
go
look
down?
better." Yeah, just they say it in their like own political way, right? Like, oh, we would very much like it if you made the numbers in favor of
It's
removing
important.
restrictions so that we can save the businesses, right? Like things like that. You want the real numbers? We likely are at 400,000 deaths already.
Oh, really? Yeah, I thought about that, because in Texas there was a headline about basically prisoners moving bodies onto trucks.
Yeah. So we've been throughout this time we've been doing our own data collection ourselves and sort of communicating with each other about the data, and it very much so is 400,000 deaths minimum
Wow.
that we are most likely at.
So
And you
even
you know things are fucked when doctors and scientists have to do their own data collection on their own time.
the final count will be close to a million in the U.S. Maybe, hopefully not. You know, that's that's absolutely insane. Like I didn't know it was
I'm
that.
inclined to agree with the Ruel.
Yeah,
Unfortunately.
you know, and that is, I'm hunkering down for sure. I have asthma, and like,
Mm-hmm.
I mean, I'd say I'm probably not the best to get the virus.
Definitely not. Nope. Yeah, that's not good.
Yeah. So with a network of doctors, right? Um, have you seen like any other country do this?
Fuck up the whole response this badly. You
Uh,
mean?
I mean that as well as I mean like underrepresent numbers.
Mm, you know, ironically, the Chinese doctors that and scientists I speak with were not asked by their government to fudge the numbers, even though our government asked our scientists and doctors.
Yeah,
I think that's really fucking ironic.
yeah.
Um, Definitely Sweden
Sweden,
is
what?
probably doing some fuck shit. Since they've been the
Yeah,
ones
because
being strong. Yeah,
I think they did the tried the
no lockdown, no mask, no nothing.
yeah, the whole what is it, uh herd immunity that has been proven not to work.
Yeah, and their numbers are low, and I don't think they're real.
There's that. What about the vaccines? So there are two vaccines, I believe. The RNA one, the Moderna vaccine, and the Pfizer vaccine. What are the differences?
So there's three vaccines. They're all mRNA. Only two of them are approved in the U.S. Most recently, this past week, the FDA approving the Moderna one.
For emergency.
Mm-hmm. Yeah,
Can you define what emergency means?
I mean, linguistically, or you
Yeah.
mean in the context of science of like what they're calling an emergency?
Yeah, what they're calling an emergency. What would be a proper use for under like emergency?
Global pandemic with 400,000 deaths in their eyes is definitely an emergency.
Okay, so it's just like use.
Yeah, yeah.
First for people that are high possibility of um what would you know, people that
Yeah,
need it
well,
first.
yeah, I mean, the emergency use is absolutely just eventually right for the whole entire country.
Yeah,
But yeah, right now it's only gonna go to the
you know that
our
America,
high risk environments.
when it comes to vaccines, is quite bad, you know?
Uh, can you elaborate?
When it comes to the public's view of vaccines, there are some
Oh yeah.
people.
Oh,
Yeah.
it's not some. It's at minimum 40% of the population, I would say.
How do we convince people that the vaccine is safe?
So right now, my goals aren't even concerned remotely around convincing people who don't want it because the people that do want it are not even able to get it right now.
Uh-huh.
Um, and won't be able to get it for a minimum of 7 months
Oh my god.
because that's how long it will take our country to roll it out to the general public.
Oh my god.
Minimum. Because
Fuck.
when Donald Trump had the opportunity as commander in chief to buy an extremely large supply of the Pfizer vaccine, he chose not to.
Oh my god. Ah,
So
man.
that is the country we live in. You know, and healthcare workers aren't even getting them. I don't know if you heard about at Stanford, um, the first like 600 to 1,000 doses that went to Stanford Hospital. The administration all gave to themselves when they've been working from home since March.
What?
Yeah. Uh huh.
There was enormous demonstration going on in
In
Stanford
addition,
Hospital.
in addition, Xavier, I'm not in Stanford Hospital, and it happened where I work too. So it's not just them.
Oh my god. Wow. This is... There we go. Okay.
I'll show you the news article. Yeah.
Yeah, if you can post it in the Twitch chat, that'd be very useful. Wow. I didn't think it was this bad.
Yeah, it's this bad.
Oh no. Yeah. That's crazy. And then there's also the fact that the coronavirus is mutating. And Americans are still not wearing masks, and
Here.
this is
Oh,
gonna
shit.
go on for
There we go.
another 7 months. Right? That's crazy.
Mm-hmm. The good news right now is, despite what the media is presenting, we're still studying the UK mutations and actually determining if it'll have a significant impact on impairing the functionality of our vaccines we have right now.
Mm-hmm.
So the good news is we can't determine yet if it's like, oh, we're fucked and we need to make a new vaccine, despite what the media is presenting. But
Yeah, the issue is, so Ruel has a question. Aren't mutations most often shifted towards a less lethal virus?
well, so you have to think about it this way, Ruel. The virus is technically mutating all the time, but due to natural selection, right? The mutations we see come up the most are the ones that keep the virus alive the most and for the longest amount of time in our bodies. So the viruses don't want to be detected by your immune system, right? They want to, like, obviously they want to be able to propagate as exponentially as possible without being detected by our immune system, right?
Yeah.
In terms of coronavirus death, it's not the it's our immune systems that kill us for the most part. It's not necessarily directly the virus. So our mutations most often shifted towards a less lethal virus. In terms of how natural selection is, it's shifted towards a virus that can avoid the immune system the longest, which is what makes it most lethal, is because by the time, if we have a significant mutation that's dangerous to humans, then it means it takes much longer time for our body to recognize it, right? Which means by the time we do, we're even more fucked, per se, than towards a previous mutation that
Ruel,
was
don't be
not as
scared.
yeah, that was not as able to skirt the skirt the like screenings of our immune system, if that makes sense.
Yeah, Ruel, don't be scared. You live in Canada.
Yeah, so with the UK mutations, we've been seeing all of those mutations already. We just haven't seen them before in combination. But since March, since March, those mutations are nothing new to the scientific community. But we're currently studying right now because the mutation in the UK is a few of those mutations in combination, whether that'll significantly impair the functionality of the vaccines we have.
Yeah.
But I wouldn't believe yet the headline saying, "Hey, we're all fucked. We need to make vaccines again from the beginning," right?
Yeah. Because we're studying. Yeah, we don't know.
We don't know. I think we'll have a monumental study come out about that in probably 2 weeks. I myself am even studying this, so
Yeah. Okay.
yeah. So I've been I've been with my institution's coronavirus research task force since March as well. So I haven't just been treating patients; I've been doing the research in addition.
Okay, based.
Um, and I have 8+ years of experience doing so, not just in coronavirus, but also in infectious disease, just like general infectious disease. I'm published on a few papers about Ebola as well, and I researched that when it was a thing.
Wow. Okay.
I really don't think the media should ever be allowed to report on science. It just makes everything such a shit show and makes our lives harder.
Because no, like, when you publish science to the media, like, then it gets distributed to people that don't know anything about science.
Yeah, and then in their eyes, right, they're just like, hey, what headline can we make that most people will click on?
Chocolate
Right.
is healthy, you know? And it, right, and then there's been evidence of that being, like, there's been evidence of that being how scientists fudge the numbers so that they get more funding and whatnot.
Yeah, I mean, which is true in some cases, but it's singular cases, but it's not true for the whole entire scientific
Right.
community.
I understand that. Yeah, so what most likely would be the best vaccine? The vaccine that we would use.
Um, in order to attain herd immunity in our country, in addition to the fact that accessibility in our country is a huge fucking problem, we sort of need to disseminate all three.
Oh, wow. Okay.
Right. I mean, people shouldn't be getting like all three vaccines, but what I mean is like to improve accessibility, right? We need to be making accessible, like more widely accessible, all three.
Yeah, also there's the fact that they are all mRNA vaccines. And
Yeah.
they also have to be stored at low temperatures.
Yeah, so the Pfizer one has to be stored at -70 degrees. The Moderna one doesn't have to be stored that
That low?
stringently. It only has to be stored at around -20. So that alone makes the Moderna more accessible. In addition to that, the AstraZeneca one can just be simply refrigerated, which makes it even more accessible. Because not every hospital has -70 degree capable freezers, right?
Right, only.
Like mostly big, like huge institutions,
Yeah.
which in the US is what, like 100 max?
Yeah.
Like 100 huge institutions max, I would say.
And mainly in big cities.
Mm-hmm.
So we could
Yeah.
probably send AstraZeneca to more rural areas and have, maybe this is just my thoughts. They're just speculating.
Sorry, what did you say?
I was just speculating that we could send AstraZeneca to rural communities more and have.
Yeah. I mean, we could even send Moderna to like the one hospital that the whole rural community has to rely on, which is another
Yeah.
problem. Um, yeah, I mean, another problem too is they're all 2-dose vaccines.
Yeah, yeah, yeah.
I can imagine a good percentage of people who get it once won't come back to get it the second
I
time,
know.
even though.
That's what I was scared of too.
Um, Furthermore, upon my review of the FDA, uh, review of the Pfizer data, um, it seems like people still remain infectious, can still remain infectious after getting the vaccine. It just protects them from the course of the disease,
Yeah, but
which is a
that's
problem.
still better
No,
than
for sure. Yeah, people will live, but it won't contribute much to herd immunity if people can still be infectious and if people can still get infected.
Yeah, but if we um
It's going to be impossible to convince people who get the Pfizer vaccine to
right.
keep wearing a mask.
Yeah, I know. That's exactly what I
Um,
was thinking. But I was explaining that
yeah.
that's why I stream so early so that I can get the wonderful quality options. Yeah, anything else that you want to talk about or say that
No, I mean, yeah, not from my standpoint. I mean, hopefully I was able to answer any questions you had and provide value to your audience. I appreciate
yeah.
you asking me to come on.
Oh, absolutely. You
I'm
probably
sorry
have a
my
bigger
schedule's
audience
been
than
so
me,
crazy.
but I probably have a more diverse audience than I would say a lot of uh other streamers in my community.
For sure. Yeah, I mean, I don't honestly, a lot of the talks or streams I do, I don't have much of a chance to respond to the chat. So I don't really know completely how to characterize my own audience. Although I do know some people in my own audience are in your chat right now.
Yeah,
uh, I'm looking at you,
politics is a
Sebs Dev, and Astria. But
politics is a tight knit community on Twitch,
mhm,
especially left wing.
yeah, I mean, especially right wing too, in the same way though.
Yeah, I
Like I
mean
was,
it's kind of an echo.
because one of my streamer friends was doing like a debate panel with a few conservative streamers,
Mm-hmm.
and and Ruel, that's the stream Ruel I first met Ruel.James on, because he came on,
Yeah, I
and it
first
was
met
almost.
Ruel
Oh, go
through.
on.
I met Ruel through Prime Kai's panel.
Got it. So I'm talking about a panel my friend Dirtbag did. Um, but basically, as soon as they started getting somewhere, a few of the right wing people on the panel started bringing in help out of nowhere.
Who out of nowhere?
They started bringing in help out of nowhere from like other right wing streamers.
Yeah,
Yeah.
yeah, that
So
happens.
they're a tight knit community too. Yeah, as of now, if you don't have any more questions to me, I will be continuing on with my dinner if that works for you.
Oh, that works for me. Uh, thank you
But
very
I'd love,
much for coming on.
yeah, for sure. Yeah, and I'd love to be on again, and I'd love to speak to you again. I'm going to be streaming a lot over the next week, so I'd
Yeah,
love to find some time to fit each other in.